Heart disease is the leading cause of death, not just for men, but for women too. Hi, I'm Terry Bennett with the HeartBright Foundation. Claire Blocker was in her early 50s when she went to the hospital for minor surgery. While there, she had heart attack symptoms and underwent quadruple bypass surgery. Claire has CVD, cardiovascular disease.
No, I had no idea. It was not a family disease that I was aware of. I never smoked. I had none of the signs I had no indicators. I've never been overweight, but it's there.
Heart disease is prevalent in our society, and the major risk factors for heart disease are high blood pressure and high cholesterol and diabetes, all of which can be completely silent.
The frustrations of this complicated disease made Claire realize there was a need for a grassroots program, a program that would educate people before they become victims of CVD. In 2002, Claire and her husband Tom Blocker created the HeartBright Foundation.
The mission of HeartBright is to reach out to others that are at risk for cardiovascular disease so they can identify those warnings early before they have to have heart surgery, before they get as sick as I did.
HeartBright does this through community outreach, serving everyone from corporate America down to our underserved neighborhoods.
The mission of HeartBright is to bring health awareness to anybody, but essentially our mission right now is working with the underserved community, which has less access to health care.
One of the ways that HeartBright reaches the underserved in the Charlotte community is through a free clinic on the west side of town.
And so what we do here at the clinic is an amazing comprehensive program because, taking medicine and going to the doctor is only half of the battle. People need to make lifestyle changes, and most of the patients of our clinic really don't have any idea what healthy food is, or they can't afford to buy it.
I'm trying to help them understand that if they do change their diet a little bit to become more heart healthy, a little less in sodium, a little less in sugar, that cholesterol levels can improve, diabetes control can improve, blood pressure drops, and that they see that immediately just in the numbers on the scale and the numbers on the blood pressure cuff.
And they're bringing awareness through health education, proper nutrition, exercise, and just getting people aware of what they need to do to take better care of themselves so they don't wind up as a cardiac patient.
I didn't know I had diabetes at that time until I started going to the A.M.E.S for HeartBright. Called it in time. It really would have been a disaster. Walking buddies program, it was good. Me and my husband, we were buddies. We walked. We walked in the mornings, like on Saturday mornings.
I support it made a great difference in the neighborhood. And the great doctors doing it for free, it's just wonderful.
We have one program that is ongoing. It's called our New Beginnings program. It meets once a week, and that offers a variety of education for these clients to come in. We offer, of course, exercise education, as well as nutrition education, as well as information just on carrying out a healthy lifestyle.
When I started, I was 254 pounds, and I could tell that whenever I would get up and move around, I was having problems breathing. My blood pressure was going up, my cholesterol was going up, and all of my numbers and everything were going up, and I was on my way to taking medication. Now, my blood pressure is perfect. I exercise every day, I eat properly, and I feel a whole lot better.
So I provide a monthly handout on how to make a better balanced, healthier, heart healthier meal for them. Sometimes it's hard to come by fresh fruits and vegetables, and actually what we've done with HeartBright in our New Beginnings class is we have started a garden through the Charlotte Green, and they have had a lot of fun growing these vegetables throughout the summertime, and they've actually tasted super yummy.
HeartBright believes that good nutrition starts at an early age, so they also help out with the Head Start program.
I am the dietitian who provides the menu for them to use every week of the school year that they're in session. Since coming on with Head Start, I have changed the diet or changed the menu a little bit to make it more heart healthy. From what I understand, it's going over pretty well with the kids. Not so much with the cooks, but pretty well with the kids.
You can also find HeartBright at work with corporate America.
Well, after I had gone through the screening and saw the benefits associated with the HeartBright program through preventive cardiology, I thought about how many people in our company here might not be aware of their cardiovascular situation. And that's when Claire proposed a program for our company to support our employees to determine if they're at risk for cardiovascular disease.
Together, over the last 5 years, we've been able to accomplish so much. With 91 cents out of every dollar going back to programs and services, we have been able to reach 4,500 people each week. We touch them with wellness through prevention, but we're just beginning to scratch the surface. We need your help. We can do so much more.
Please visit www.heartbright.org to learn the many ways in which you can help the HeartBright Foundation continue its mission to enlighten one heart at a time.
It's made me realize how precious each day is. Each day is a gift, and life is a blink. I mean, life is a blink.